linkage to care as well as retaining individuals in care is very difficult in Southwest Arkansas, specifically the Texarkana region. And the major barrier is transportation. There's maybe one or two providers in that area, and it's a small area, so HIPAA and feeling safe and in a secure environment is very important. So transportation becomes a large barrier in which individuals have to travel probably on average like 2 hours to get to their appointment. And that's where our Positive Miles program has came in to really help eliminate that barrier that individuals fear or that they have. Transportation is major, especially being in a rural area and not having public transit. In addition to transportation being a major barrier, residents and people that are in Texarkana and Southwest Arkansas also experience barriers such as housing, miseducation, as well as stigma. Stigma is everywhere. It's all around, and that the stigma drives a lot of the barriers that are also put in place for people that are down in the Texarkana area.
One of the challenges that I've come across with linking people to care, because I deal with a lot with the homeless population, one of the challenges is because a lot of them, they get assaulted in the streets. They get their things taken from them, and they end up having nothing over and over and over again. EAC really allows me to help the community that I serve, because a lot of these people around here, like, they only have condoms access through paying a quarter or paying $1, and a lot of them don't even have that much funding to pay for a condom. So me being able to have a bag with like 15 condoms and running out the door to give it and put it in somebody's hand, that makes it more easy on them. And I've even had feedback saying that people are telling other people in the community that we're here.
One of the things that we've learned in our time of work here in EAC is that one size doesn't fit all, and that one disease doesn't exist generally in isolation of all others. And so we try to do what is called a syndemic approach to prevention work. And by that we mean that we are testing for multiple diseases and multiple epidemics at the same time. For example, HIV and syphilis and chlamydia and gonorrhea and hepatitis and TB education. And so we want to educate as well as do the screenings for these types of conditions all at the same time, so that whatever the need of a person may be able to find our same way back to finding the prevention resources that they need. It's also important to know that people living with HIV have a multitude of needs. So what we've tried to do with EAC is to use community health workers as well as community health specialists and other resources and individuals in finding the specific needs that a person may have that's living with HIV, so that we can improve the quality of care that they get and find maybe those little niches that the other types of treatments and care might miss.